All right. Hi to everyone who is joining us. This is another Conversations with Women in Wellness where I get to introduce all of you to a female professional with a heart to serve others and talk a little bit about what it is that they do, who they support, and what resources they may have available for you to explore. I'm Britt Reuter, and I'm a functional medicine nutritionist serving women experiencing gut issues, hormone imbalances, and autoimmunity. I run an online virtual clinic from my home in the Boston area. And if you want to learn more about me and what I do, you can visit my website, www.brittreuter.com, or find me on Facebook or Instagram at Nutrition Brit. Today, my guest is my friend and colleague, Dr. Cassie Wilder. Dr. Wilder is a functional medicine doctor and founder of Minneapolis Integrative Medicine Center located in Minneapolis, Minnesota. She is a primary care physician, but has a special passion for helping women to optimize their hormones, their thyroid and adrenal health, as well as correct digestive concerns. Thanks for joining me here today, Dr. Wilder.
Hey, thank you for having me.
Yeah, absolutely. So I want to start out by asking a burning question that I have. What does a day in the life of Dr. Wilder look like as far as your health routine goes?
That's a funny one. And actually, it's one that I get often. And I really still think that my perfect health routine or my health routine in general is seriously always changing. On a typical day, I guess I'm a morning person. I love the mornings. I love waking up, getting a cup of coffee, taking my supplements. Right now I'm taking a thyroid support, an adrenal glandular product, a adrenal herbal product. So I'm like double hitting right there on my stress control and adrenals. And then I'm also taking a testosterone support because I did some blood labs on myself and found that I was pretty deficient and low in testosterone, which has a pretty big integral part in your motivation. And so that's something I noticed that I was kind of lacking, was a little bit of burnout and lack of motivation to do, what do I say? Do the really tasks that I really didn't want to do. And so just supporting my testosterone there. I typically head straight to work and then just jump into it. So really just jumping into work is really energizing for me. And so one thing that I wanted to comment here, because when I get asked this question, everyone's like, well, how many times a week do you exercise? Are you going to every day going to 30 minutes or 60 minutes? And that's not what I do. So I only exercise at a group fitness place one time per week. And honestly, it's something that I've internally struggled with for a really long time, because in April of 2018, I had an unlimited membership to one of the really local trendy gyms, and I loved it and it was great. But I would wake up and be like, oh my gosh, I have such a busy day. I have so many things that I have to get done today. But now I have to spend, almost an hour and a half getting to the gym, getting home from the gym, showering, getting ready for my busy day. So it was taking up a ton of my time. And I was getting massive anxiety about going to the gym, which is pretty counterproductive when it comes to thinking about exercise. So I actually quit my unlimited membership. I signed up for a token-based or a points-based system that you can get online. And so I only go one time per week and I change it up. So that's kind of the most standout thing I feel like from my health routine is that I find it okay to only go to the gym once per week. And then I get in my 10,000 steps and my walks. So that's my exercise. So
yeah, that's awesome. It's kind of like having that awareness of when self-care becomes the opposite of self-care. Yeah. That's awesome. So I'm really curious how it is that you came to discover naturopathic and functional medicine. You're a doctor, so we know that you're super smart. Did it ever cross your mind to pursue a career in Western medicine as, say, an MD, or were you always set on earning your doctorate in naturopathy and pursuing functional medicine?
So that's another great question. You're hitting all the good ones right up front. So I really discovered functional medicine after kind of my pedestal for the modern medicine system really fell and shattered. So I did pre-med at Iowa State, and I shadowed internal medicine, gastroenterology, and family medicine. And I just remember walking through the halls of the hospital as we're doing rounds and thinking, like, oh man, we get to see the next one. Like we get to help these people and really get to solve their problems and, cure their diseases and get them home and happy and healthy. And what I found was that we really didn't dig into, what were they eating? What was the root cause? Like really asking them their story. We basically go in, ask them, how are you feeling? Oh, you're feeling this way? Okay, let's run these tests or do this procedure. And we did a lot of colonoscopies. And then it was really at the end of the day, there's nothing wrong with you and you can go home. And these patients were still saying, wow, I still have abdominal pain. Oh, I still am not pooping every day. Like I still have problems. And we were, I remember talking to the GI and he said, I said to him, can we ask her what she's eating at home? Like, is she getting enough fiber? Like, what is she taking? What are her medications causing this? And he looked at me and he said, that's not your job.
Whoa.
I was a little confused at first. I was like, that's not our job to ask our patients what they're eating, how they're exercising. Like, that's not our job. I don't get it. We're doctors. And he said, that's the dietitian's job. And so I'm starting to think like, okay, so we're piecing out all these aspects of patient care, but we're never going to ask the dietitian, or weigh in with the dietitian on what they should be eating or what they are eating. And so I guess that's when my pedestal really kind of shattered was I won't ever get to talk about, what people are eating. I won't get to talk about them exercising. I won't get to introduce anything natural like herbs or supplements or nutrients. And that was something that I was really interested in and I felt was really integral to patient care. And so I withdrew my application to medical school and all my interviews, and my mom was so livid. And so it was my boyfriend, who's now my husband at the time, but they were both really upset with me because medicine is on this pedestal. Doctors are on this pedestal to where they are the mecca of all medicine. Western medicine is the mecca. And what I found when I was ingrained in that world is that they're not really the mecca. They don't have all the answers. And if you need to look into your colon and find out if you have colon cancer, that's a great place to go. Don't go to me to look inside your colon. But when it comes to gas, bloating, abdominal pain, constipation, diarrhea, all these other functional disorders, they were providing no answers. And those are kind of the answers that I was interested in most treating. And so I actually went to a biomedical nutrition conference right outside of school, and it was taught by a naturopathic doctor, and I had no idea who she was at the time, but she really talked about biochemistry and how introduction of certain herbs would push certain pathways and introduction of certain nutrients would push these other pathways, and this is how you could really get to the nitty-gritty of prescribing therapeutic nutrition and therapeutic supplements to push biochemistry. And you should have seen my eyes. They lit up. I was so excited and energized, and that's just what I wanted to do. And as the universe puts you in a place where you really need to be when you need that particular thing in your life. And I sat next to her on the shuttle back to the airport that next day, and it was just hey, I was so just enthralled with what you were saying. Can you tell me who you are, what you do? I need to know more. And she just filled me in that entire time. And I think that conference was in October. I applied, interviewed, because I had already had the prereqs and everything. I applied, interviewed, and got in by December 1st and moved to Arizona Jan 1 and started.
Wow.
Once you found it, it was it just sucked me in, I guess. So and then I spent 4 years in naturopathic medical school and really got to learn 2 years of nutrition, 2 years of herbs, all of the same conventional treatments. So as we're learning about high blood pressure, we get to learn JNC8, which is the medication algorithm for how to treat someone with high blood pressure. Yeah. However, at the same time, we get to learn what are some dietary strategies, what are some herbal strategies. Oh, can't take that herb because it interacts with this medication. So really, how can we personalize someone's hypertension protocol from both a short-term management with drugs, but then a long-term goal, long-term solution with lifestyle stress modification, herbs, and supplements. So yeah. That to me is what medicine should be. And so I guess I feel very fortunate that I found functional medicine, that I found naturopathic medicine so early, because a lot of my classmates were significantly older than I am, coming from second, third careers. Some of them MDs, some of them chiropractors, and really not learning about this piece of medicine until kind of later. So I feel really fortunate to have found it so early.
Yeah, I mean, that's so interesting that you experienced the, just the disenfranchisement so early, being able to do that clinical experience and really picturing yourself assuming that role for a long time. I mean, having a long career in, Western medicine and, imagining what that like lack of fulfillment that, like it's a little bit disjointed, like you're saying, where it's like everybody has their specialty, nobody's really communicating about holistic care of the patient. It's like, stay in your lane, and it really robs the patients of the results that they're hoping to achieve.
Yeah, no, it really does. And you can see that by the patients that walk in my door now. I'm requesting records from 10 different physicians, 10 different clinics who have run just myriads of tests, and they're still having the same issues they've been having for years. And so you can see the outcome of the disenfranchisement is really through the patients.
Yeah. Wow. Oh, that's such a powerful story. That's so good. Thanks for sharing that. So I have a little bit of a tough question to throw at you now. If you could tell all women, because women is the key demographic that I serve, so I know that we have a lot of women watching this who want to know this from you. If you could tell all women one way to improve their wellness today, what would it be?
I would think that, I feel like the standard thing that I should say is some sort of supplement recommendation. However, natural medicine doesn't work overnight. And so kind of what I really want to say, and what I think that starting today, something that could really help people is to start saying no. So I find through my patients, I have a lot of women in my practice, that women are givers. And so it's in our nature to really overcommit, overwork, and really wear this exhaustion and overwork as a badge of honor. And really the only person that is getting bettered in a relationship where you're giving out too much of yourself is the other person.
Yeah.
And so women have started, wearing this badge of honor, and it's killing our adrenals, it's killing our thyroid function, it's making us tired, it's making us gain weight. And then we start to not recognize ourselves both on the inside and the outside. And so I find that just by, I don't know if I can curse on this, so maybe I'll just
sure. Yeah, that's fine.
I just recently adopted this. Like, if it's not a hell yes, then it's a hell no. And so that's one thing that I have started implementing in both my life and clinical practice, is just really helping people parse through all of the commitments that they have and thinking which ones light me up, which ones energize me, which ones drain me, what are required, and then how do I manage all of these things and still be able to heal. So right. I think that's a huge one for women, because we like to give. That's our nature. Our nature is to nurture and give. And I don't know, I think it's the only person that it's hurting is us.
Right. Yeah. It's kind of like that saying where you can't pour from an empty cup, where it's like adopting more of a long-term perspective. It's like acknowledging that it's in your nature to nurture, like you're saying, but then, reserving something for yourself.
Yeah.
Yeah. And I like how you said that, where it's like you're, thinking about, is it a hell yes? And if not, then, it has to be a no, and kind of putting your health first, and using that as the, if I'm putting my health first, what do I really have time for after that?
Yeah.
That's such a good way to frame it. I really like that. It's awesome advice.
Thank you.
Yeah. All right. So now let's do some rapid fire questions. Okay. You ready?
Yep.
All right. What is your favorite supplement?
Adrenal glandular. All day, every day.
And your favorite midday snack?
Hard-boiled eggs and hummus.
Favorite road trip food?
My husband and I really like getting these nitrate-free jerkies from Costco, and those are our favorite road trip treats.
Yum. What is your favorite remedy?
So my favorite remedy I mean, so basically for sleep, I find sleep to be of the utmost importance in a lot of my patients, and something a lot of women struggle with, especially that like ruminating thoughts, that mind that just won't quit. And so my favorite remedy for that is passion flower.
Ooh. Is there, do you like to have it in like a mix with other herbs, or do you look for just like a pure passion flower supplement?
So if I don't really know them, then I typically just say like a pure passion flower supplement. But if I get to know them and, you know, I hear about some of the other struggles that are going on in their life, there are a lot of other cool herbs that can help. So like passion flower will help calm the brain down, but then there's Avena, and Avena really helps to tonify and nourish, I guess, the adrenals and stress response. There's Tilia, and Tilia can help. It's an anxiolytic as well as a sleep support. So kind of just like listening to the person and talking to them and figuring out what their struggles are can really help kind of customize a blended formula. But
awesome. Yeah. I mean, custom is key, right?
Yeah. I mean, that's how you get the best results.
Absolutely. Yeah. That's so cool. I use passion flower sometimes too, because I mean, ruminating thoughts, you hit it right on the head. I'm sure so many women are nodding their heads along with us, being like, help us, please. Great. That was great. Well, this has just been so much fun. In case anyone who's watching this wants to connect with you or learn more about what it is that you do, what is a good way or some good ways for them to stay in touch?
Yeah, so I actually spend most of my time on Instagram. So my handle at MPLS Integrative MC. It's kind of become my soapbox or my platform for educational nuggets and inspiration. So I tend to spend a lot of my time there and crafting captions that really educate people on there's another way of approaching your health and approaching medicine. And so follow me there. And then we also post a weekly blog post to our wellness library at the www.mplsimc.com wellness library. And so if you'd like to not have to remember to come check every week, and you'd like me to just send it to you every week, we have a newsletter list too. So, and that newsletter helps people stay informed about what classes we're teaching and how they can connect with us. So
awesome. Well, those are great resources. So that's it. Thanks again to Dr. Wilder for joining me today. And thanks for all of you for sharing with this conversation with us.
Yeah, it's been my pleasure.
Thanks.